Ready, Derek?
Good day.
Okay, good afternoon, everyone, and we'll get started today by asking our Chief Medical Officer, Dr. Fitzgerald, to give us an update.
Thank you, Premier. Good afternoon, everyone. Today I would like to advise that we have 11 new presumptive positive cases in Newfoundland and Labrador. These cases are all within the Eastern Health region and are related to either travel or a cluster of previously identified cases. A cluster of cases is a group of related cases. Public Health has initiated contact tracing. Those who are close contacts will be advised to stay at home quarantine. Our total number of cases now is at 35. We have tested 1,131 people, and of those individuals, 1,096 have been confirmed negative. We are in a public health emergency. Yesterday, I put in additional measures to protect everyone's health and safety. Today, I am ordering that all private health clinics, with the exception of physician and nurse practitioner clinics, close. If a clinician is needed to provide urgent or emergent services, they may open only to provide those services. I expect, by way of example, for dentists, optometrists, physiotherapists, dietitians, chiropractors, psychologists, registered massage therapists, osteopaths, dental hygienists, acupuncturists, and audiologists to close their clinics. Of course, if you can provide virtual care, please do so. To those that are healthy and well, unless it is necessary for you to get things like groceries or other essentials, I implore you to stay home. I know grocery stores have been very accommodating and offering options like special hours for seniors and others who may be at increased risk for severe disease. These hours, though, can still be busy. If you are over 60 or have underlying medical conditions, consider arranging with a friend or family member to get your groceries or medications. This next message is to everyone. If you are sick, stay home. This is not the time to go to work if you are not 100%. Going to work when you are not feeling well puts you and those around you at increased risk. All but essential workers should stay home. You must adhere to measures we have put in place and to the principles of social distancing. Stay home except for essential reasons. If you are enjoying the outdoors, do so while respecting the principles of physical distancing. Stay 6 feet apart. Wash your hands frequently and well. Continue to support your family and friends through these difficult times. I know that these are difficult and unprecedented times. We all have a job to do to reduce the spread of this virus. Our actions today will determine how COVID-19 progresses in our province. Thank you.
Thank you, Dr. Fitzgerald. And as you said, we are in a public health state of emergency. We cannot stress this enough. We can do this because we have some of the most progressive and latest legislation on public health emergency in this country. And we put this in place, as Dr. Hagee has said many times, a little over a year ago. These measures were put in place to protect you and your families. But once again, I have to be frank with you. And as I said yesterday, this is a critical time for our province, for all Newfoundlanders and Labradorians. What we're seeing here today is a result of people going in a public setting and spreading COVID-19. This is unacceptable. So when you socialize, remember, socialize in gatherings of 10 or less, but socialize only when necessary, as Dr. Fitzgerald has said about shopping and so on. If you do not follow those guidelines, you have to know that you are threatening the lives of loved ones and your own life. So we cannot stress this enough. You need to stay home because we are indeed talking about saving lives. Now, we have put every measure in place to protect you and your loved ones. And in fact, every day, and sometimes more than once a day, I talk to our opposition leaders, the leader of the official opposition, Mr. Chess Crosby, and the leader of the third party, the NEP, Ms. Alison Coffin. And we do this because it's through our Joint Public Health Response Committee, and we're looking for collective priorities, areas that we can provide appropriate responses and seek consensus on how to move forward on the health and safety of all residents within our province. Of course, we do this on the advice of our Chief Medical Officer. It's by working together that we will see results. But not only our committee, not only by Minister Hagee and Health and Community Services or our Chief Medical Officer, we need every single Newfoundlander and Labradorian to follow the measures and the guidelines that we have put in place. We know that what we've put in place, like limiting the number of people in gatherings, limiting the number of people attending to funerals, restricting businesses, and so on, that these can sometimes be very emotional, they can sometimes be very difficult. But these decisions are necessary. They will save lives, and that is what matters to me right now. And that is what matters to people in this province. We've put numerous supports in place as we make our way through this pandemic. But our government certainly appreciates the work of some of the community-based organizations every day. And it is in times like the crisis, the global crisis of COVID-19, that their importance in our communities and the work that they do around our province, we recognize their importance once again. They are our partners. They are well positioned to help families and communities that are in need. So it is important that we stand together in this unprecedented time and we take every step that we can to support our citizens. So today I'm announcing that we are continuing to support those community-based organizations to more than $120 million in funding that will be allocated for these organizations that are positioned in communities across our province. This will help them continue the important work in supporting you, the families, and our communities. And this will be for the fiscal year 2021. The global crisis and the impact that it's having on social and economic well-being on the residents and our businesses within our communities can be supported by these organizations as they are deep-rooted and well-positioned to help us respond to those challenges. But in addition to this, we have another 22 organizations that we have made commitments to multi-year funding. And this is another $18 million that we support those core organizations every year, and we've been doing this since 2018, and that will continue. So we also recognize that within these organizations, we have some 16,000 people that work to support the volunteers throughout our province. So our government will continue to work with these community-based organizations to overcome potential issues and to capitalize on the opportunities to move their sector forward. So we will continue to work with them. It's important that we position this province and in this time of a health crisis that we also must be ready as we work our way through this and we do come out the other end, that we are in a position to rebuild this province. I also want to remind you today that it's an important aspect of ensuring that we get those measures right, we get the information and the education that you need to support yourself and your families. Now, we have a very busy website, but I want to remind everyone, if you have questions or you have concerns, to please visit the website, gov.nl.ca/COVID-19. The information is there to support you. But there's another important tool that exists on that website, and that's the self-assessment tool. Visit the tool, fill it out. It will give you some idea of where you are personally, where you are in the situation around COVID-19. Now, if you have concerns on issues around self-isolation, for those of you that are either visiting the province or you're a resident of this province, I encourage you to call the Red Cross helpline. This is different than the 811 line, and we've put this in place to help release some of the pressure off that line. So this is for those of you that have questions around self-isolation. The number of the Red Cross helpline is 1-800-863-6582. So call that number if you have questions of those that are self-isolating. I also want to speak to those of you that are feeling stressed at this time. I will tell you that when I listen to friends, family members, and communities across our province, many people are finding the stress and the anxiety of dealing with the situation around the world. You're seeing the news, and you're watching what's unfolding in other provinces and other countries. So there's a level of stress and anxiety that can be expected. But my message to you today is that you are not alone. If you have questions about yourself or family members around the stress that this has added, feel free. Visit our website. It's called bridgethegap.ca. It's at that website that you can be that you will find information of the resources that we have within government and the supply of mental health services to residents within our province. We also have a warm line that is available to talk to someone that is trained, but not only trained, someone that also would have lived experience on mental health. So they can talk with you, sharing your experience and the experience that they have in their own life. That's our warm line. But also for you, those of you that are experiencing a crisis level at this particular time, our mental health crisis line is also available to support you. I have to say, we all agree that these are tough times. Not just tough times in Newfoundland and Labrador, but these are tough times across our country and around the world. But it's never lost on me, our Newfoundlanders and Labradorians, that we come together in these difficult times. So we have a large number of health officials that are working diligently on your behalf day in and day out. They put in guidelines. They make sure that financial supports for those of you that need them, that they're available. But I will tell you, I get messages on a daily basis from people that we are working with. They are encouraged and they are inspired by the positive posts, the pictures that they have seen coming from residents. And it's these posts, these pictures that brightens their day in what otherwise can be a very dark time. So as I was looking out through my office this morning, I saw a young family who were practicing social distancing as they were playing with their pets and their kids. It was encouraging to see. But we also know that we must do this in limited ways, practicing social distancing. We've seen pictures of family. We've seen pictures of seniors in long-term care homes and personal care homes, as you're now finding new ways to connect with their families that are not close to them or cannot be close to them today. We know that as a province that we can face adversity. This is not new to you. This is where Newfoundlanders and Labradorians, this is where we shine. But today, again, I want to remind everyone of the essential workers who are working through this for you. We have utility workers that are making sure that our utilities are still intact, that the power is flowing for us. And as we wait yet another weather event tonight, here in many parts of Newfoundland and Labrador, it is these workers that will be there to support you. We have grocery store workers that many of you only get the opportunity to see once a week and sometimes less than that, but they are working there day in and day out to support you. We have healthcare workers, and we have our first responders who are doing everything that they can to keep you healthy. They are leaving stressful home lives as could potentially see their partners or some of their family members that are laid off or are not working because of the impact on business. But yet they go into those stressful workplaces, taking the stress of family, the added stress of what COVID-19 is meeting to our province, and they are doing this to protect you. So today I'd ask you to reach out and send a thank you to them as well. These are people that are leaving their homes because they have no choice, because they need to provide good quality services for you and to you during this pandemic. So I want to thank you once again for listening. I want to thank you for reaching out to those that are doing some great work. But I also know that through the stories that are coming in through social media and the phone calls that we are getting and the emails that are coming in and notices that not everyone are following the guidelines that we put in place. My message to you is that this is completely reckless. In this crisis time, why would you risk your own life and the risk of others? It's not a visit from a law enforcement officer that we want to be talking about today. Is we want to send a very clear message to you. Be responsible. Think about what you're doing. And I will say that these are not just young people. These are just not carefree young people. There are people today that continue to break those guidelines, are some of the most mature people that we have in our society. That I will tell you, please be responsible. Please respect those around you. Follow the guidelines that we have put in place. Stay home. Think about your future. People look to you for leadership. Please listen to what Dr. Fitzgerald and the guidelines that we put in place through Minister Hagee. This message is very clear. You do not have a right to jeopardize the lives of others. So, ladies and gentlemen, be diligent. The time is now to continue the work that we have been doing, continue to support the people that are doing the work on our behalf and your behalf. So thank you very much. Mr. Hagee.
Thank you, Premier. You may recall yesterday that I started the day by talking about people who are frightened and panicky and how it's difficult to think and to stay calm. But I had a testing time myself yesterday, because by the time I went to bed last night, I was so frustrated. And I'll tell you what it was about. It was about a video that was posted on Facebook that I can only describe as malicious and deliberate. It was of people appearing to come down the stairs at the airport to an empty baggage area where no one was meeting their flight to advise them of the health issues around COVID-19. What nobody knew was that that flight was a domestic flight. It originated within the province. There was no one on that flight from outside this province who had not self-quarantined. The effect that that had on the public in terms of undermining confidence in our public health system and the work of our healthcare professionals, and the demeaning and demoralizing effect it had on those staff from Eastern Health who spent all day in that baggage hall meeting flights from outside the province, cannot be calculated. I cannot fathom why anyone in their right mind would do this. It is simply malicious and unforgivable. This is not who we are. So please, please listen, and please think that what sounds like a good joke after you've had a couple of drinks on a plane is not a good idea in the health and well-being of the people of this province. I'm sorry if I sound as though I'm getting a bit heated, but that was really a bad way for all of us to end our day yesterday. And to speak of those healthcare workers and workers in healthcare, I cannot say enough about the way that you have risen to the challenge. I've had some comments in social media and through email about why non-essential workers are in acute care facilities, and I would suggest that those are not non-essential workers. They may not provide direct hands-on care to a resident or to a patient, but these are the people who keep the hospital clean, who keep this virus at bay with their own skill set, janitorial and workplace safety. These are the people who provide food for our residents and for our staff. These are the people who provide sterile supplies. They unload goods and check inventory. And we have, wherever possible, sent those people who can fulfill their duties home, where they can do their work from the comfort and safety of their own home. These people get up at the crack of dawn, they go home late at night, and they're doing this to keep you safe. And I take my hat off to every one of them, nurse, janitor, respiratory therapist, or support worker. Again, we've seen in the media about why have we not got a state of emergency? I explained that yesterday. We have a public health state of emergency. We have the most progressive, wide-ranging, and definitive powers that we can provide Dr. Fitzgerald. They are better than any other jurisdiction. Daily we look at our risk profile and say, what is it we need to do today to tune our response as COVID-19 changes? Every day we make those changes. There is not anything we have seen or anything we can reasonably foresee that we cannot do under the authority of our public health state of emergency. We have across the province in a state of readiness as regards personal protective equipment. I was on a call last night with my federal and provincial counterparts. My staff informed me this morning that an initial delivery from the emergency stockpile has arrived in the province in addition to our regular supplies. We have regular contact through our provincial supply chain now with a group of business entrepreneurs who have sources and resources that will help us rise to meet the challenge of PPE and ventilators and anything that we can reasonably foresee we might need in the foreseeable short term. Our measures, which started from a preparatory point of view 10 days ago, a week ago, where we reduced and abolished elective procedures, have started to yield dividends. Our provincial average acute care bed occupancy is now down to 62%. Our ICU occupancy across the province as of yesterday was 54%. And yesterday we are using only 13% of our ventilator capacity. We have created a surge capacity in terms of beds, staff to care for the people in those beds, and resources. I can only applaud the work of the staff in facilitating discharge of patients to the safety of their own homes. There was concern yesterday around these people who have not felt the need to comply with Dr. Fitzgerald's orders, and I can only echo what the Premier has said about the responsibility people need to show in these situations. Communities look to their seniors, they look to their elders for guidance, and I think it's crucial that that guidance is provided. Young people are crying out for it. We have 356 complaints currently, I'm informed by the RNC, that will need action. We have meetings planned with the RNC, and because of jurisdictional issues, we will be meeting with the RCMP as well within the next 24 hours to see what action needs to be taken. There are 38 of these complaints that have been concluded, and 127 of these were groundless. We don't want to use this. This is not who we are. As the Premier said, the opportunity to flatten this curve, the opportunity to make a difference to ourselves, our families, and our communities is now. The time is now. As the Prime Minister said yesterday, enough is enough. It is time, whenever possible, to go home and stay home. Please listen to that message. Thank you very much.
Thank you. Please press star 1 at this time if you have a question. The first question is from Patrick Butler with Radio Canada. Please go ahead.
Hi there. Premier Blaine Higgs of New Brunswick has suggested that it's time for the federal government to invoke the Emergencies Act. Would you support such a measure?
So the question would be about the Emergency Measures Act or the Emergencies Act. So we had a great call, which lasted nearly 2 hours with the Prime Minister last night. Of course, this was a topic of discussion. I will say that as we went around the province, around the country, that most premiers, I think all premiers, would have agreed that at that point, where we are right now, we have the ability to put in place the requirements and the restrictions that we need to put on our individual provinces that would help guide us through this COVID-19 crisis. We were very clear that any measures that will be taken by the federal government would be complementary to the measures that would be in place in our provinces. But coming out of that meeting last night, I think there was a commitment and a willingness for all the premiers to work together and the Prime Minister to work with each and every province. So I feel right now where we are that we have the ability through the legislation that Minister Hagee and I and the Chief Medical Officer that we have the appropriate legislation that we available to us now to put in place the necessary restrictions to help guide us through this current crisis.
And I'd also like to ask you a question about food supply in Newfoundland. Can you give an update on sort of this necessary food supply infrastructure in the province? And should people be worried? Have there been any issues observed to do with the food supply thus far?
Yeah, late yesterday, I did speak to, some people that are responsible for distribution within our province. And I'm not, and certainly I've been talking to them, over the last week or so. There's no concerns right now. In contact with Marine Atlantic, the supply of goods, are available and coming into the province. So there's no, what I know, no disruption in food supply or essential supplies coming into Newfoundland and Labrador. That would include, medical supplies, food supplies, and those things that are deemed necessary or essential for services in our province.
Thank you. The next question is from Peter Cowan with CBC. Please go ahead.
You've talked about retail businesses closing. I'm looking for a bit of clarity here. Lots of people have been wondering about things like car mechanics, where you need to go, it's still pothole season and problems still happen, as well as people who come into your homes and repair. What's the current status on that, and what's the current best advice?
So repair services are still considered essential services. Obviously, as you've said, you need to have repair of your vehicle if you're an essential worker and you have to get to work or you have to get out for your groceries. And obviously, if you need a plumber or an electrician in your house to fix that, you need to be able to have those people come in. Of course, we would recommend social distancing, washing your hands frequently, practicing all those safety measures.
The follow-up, you mentioned that some of the new cases are all related to this cluster, and I believe yesterday you'd said there were 8 cases. Again, this all seems to trace back to one funeral home. Can you give me an idea of how many total cases have all come from this one individual who earlier tested positive, and how concerning is it for you that we're seeing one person have the ability to infect so many people?
So the investigations to most of these cases today are ongoing. So I can't give you definitive numbers as to how many are related to that cluster. What we know is that many are related to close contact within that cluster, which is not an unusual situation to see, that if you have a lot of close family contact that you will see spread. And it's not necessarily one person who's spreading it to all of those people. It could be that one person spread it to someone else who then spread it. So the investigation is ongoing, and it does appear that most of the cases are within close contacts.
Thank you. The next question is from Ben Murphy with VOCM News. Please go ahead.
Dr. Fitzgerald, is it fair to say now that we are seeing spread of the virus throughout the community?
So what we have seen so far are travel-related cases, and within this cluster, we have seen secondary transmission of this virus, but we have not picked up cases outside of this cluster in the rest of the community.
And now a group of internal doctors, they sent out a message today with their own urgent plea, with more concerns as well about community spread, raising questions about whether someone without symptoms could be spreading this virus. Yesterday, you said the information on asymptomatic transmission is evolving very quickly, and if you get new info that changes the way you have to do things, you will do it. Is now the time to maybe start doing that?
So, as I said, the information is evolving quickly. Those discussions are actually ongoing at the national level, at the federal, provincial, territorial level as we speak, and we will be having further discussions on that later this afternoon.
Thank you.
Thank you. The next question is from Peter Jackson with The Telegram. Please go ahead.
Hi, this is a question to Dr. Haggie. Have you actually made any arrests? And if there haven't been any arrests by the RNC, what are the standards for the RNC? How do they approach someone who may actually be positive for COVID-19? Are there any standards in place, such as at courts as well?
It's a very good question. We have a list of complaints that need some form of further investigative action. We are meeting at a staff level today with the RCMP and the RNC and the plan is for staff to develop some recommendations for a meeting between myself and the leadership of those two organizations tomorrow to decide on a way forward. We certainly have access to the courts should we need it. In terms of actually how an officer, a law enforcement officer, might approach someone who was thought to be COVID-19 positive, we have, in conjunction with those forces, worked out a series of guidelines in the use of PPE. So each of those elements is poised. We will integrate them, and we will be in a position to announce some further over the next day or so.
There have been rumors, and I emphasize the term rumors, that a couple of, at least one or possibly two grocery stores are actually in a situation where they're having to stop someone from coming in because they are either suspected of having COVID or supposed to be in self-isolation. Have you had any cases like that come to your attention?
I've had some forms that have gone through, and these are under the categories I've described. Whether or not they're under the complaints that need attention or whether the ones that have been concluded, I would have to go back and check. Just to address the rumor, and I'm glad you emphasized the rumor piece, one of the challenges has been very clearly getting accurate information about these situations, and that's one of the reasons we put the form and the online reporting in place, because the material that was being provided on an ad hoc basis was unstructured and basically impossible to assess. While I have the microphone on the subject of rumor and information sources, I would like to also repeat what I said yesterday, which is if you want to know what to do about COVID-19 in your particular situation, there is a trusted source of information on our website, and that includes clinical material. If you feel you need to self-assess, there's a tool there, as well as direction as to how to proceed if you feel ill, but also resources and frequently asked questions and clarifications, the latest version of our Medical Officer of Health orders, for example. So that's the place to go if you want to find out whether it's fact or fiction.
Thank you.
Thank you. The next question is from Kellyanne Roberts with NTV News. Please go ahead.
Premier, you say that if you must have a social gathering, that it be to a 10 people limit. Why not just eliminate social gatherings completely and not have a 10-person limit? Because now we've moved from 50 to 10. Why not just put the precaution in place to have 0?
Well, we take the advice from the Chief Medical Officer and gatherings of 10, and one of the discussions that I know that we had, and because we've asked those questions as well, you can take this down to any number you want, but there is a level of responsibility on individuals and families that the first and foremost is do the appropriate thing, do the right thing, limit the number as low as possible. And the other thing is, as we just mentioned here, we can talk about, what the right time is for asymptomatic, testing and so on. The best thing to do is practice social distancing, because we can prevent this from happening, like washing hands, good physical hygiene, of course. So wash your hands often and practice social distancing. So the size of the gathering is one thing. We're now at 10 or less, but yet do the responsible thing. Keep that number as low as possible.
Thank you. And many business owners and employees aren't clear on where they stand in relation to closures and exemptions. There are gray areas. Car dealers who have garages, do they close one segment of their business and open another? Construction workers, some say they can't effectively work safely with social distancing. Fish plant workers insisting it's impossible, yet they're considered essential because it's food production. How literal is the existing list of exemptions to be taken? And is it fair to say if your business scope isn't on it, you can operate?
Well, one of the things making decisions like this in a very busy environment when it comes to some of those small businesses, and as Minister Hagee, the Chief Medical Officer, and all of us have said, you can never be perfect when you make those decisions, and there will always be areas that will need some further defining and will be a little gray. We make those decisions to protect people from the spread of COVID-19. This is the reason why we make them. And of course, when we do so, there's impacts with businesses and employees within our community. So as been mentioned already, if you're a garage owner and And I had messages this morning about garage owners, service stations that supply and support, ambulance services. Well, of course, we need those services to continue to make sure that we have our ambulances on tip-top shape, within our province. So it's important for that business, as an example, to stay open. So this is not about being overly, punitive. This is about protecting people and making sure that only those essential workers providing essential services to our province, to our residents, those remain open. So it's going to take some time to define this where we want it to be, but we're just asking people to do the responsible thing. If you're not an essential service, and let's just shut it down. But if you're providing essential service, well, we need that to be in operation.
Thank you. The next question is from Holly Mackenzie-Suter with the Canadian Press. Please go ahead.
Hi, I have a question about hydro power rates. Ontario is expected to announce a temporary cut in hydro rates as more people start working from home. Is that something that's being looked at in Newfoundland and Labrador?
Right now is not something, that's being considered. One of the things that we've been able to say to people in our province, that as families and probably businesses find themselves, a difficult situation, what we know from the utilities is that they will not be discontinuing services. In other words, they will be not cutting off the services, to families, in this time, in this critical period. So actually, what we're seeing in Ontario is not really this is really deferring the bill. It's not eliminating the bill. And so right now in our province, what we have in place with our utilities is that they would not be cutting people off, discontinuing those services because of financial reasons.
Thank you. And a question for Dr. Fitzgerald. Out of these 35 cases right now, how many are confirmed?
At the moment, there are 4 confirmed cases. That is cases that have come back confirmed from the National Microbiology Lab.
None in hospital, right?
Thank you. The next question is from Elizabeth Witten with All Newfoundland Labrador. Please go ahead.
This question is for Minister Haggie. You made a comment a little earlier, and I wanted a bit more elaboration on it. So we often hear talks about flattening the curve and that we have a brief window of opportunity to do so. So yesterday we went from 24 to 35 presumptive and confirmed cases. So is this within the acceptable numbers that we're looking at?
You raise a very interesting question, and one of the discussions we had at the federal, provincial, territorial table last night was actually around mathematical modeling and how we can try and develop something of a crystal ball around these numbers. We have seen jumps in the numbers, but these have been from cluster effects where 1 or 2 individuals who have traveled and brought the virus back have managed to pass it on by close and direct contact. And at this stage, with the numbers being fairly small, my understanding from the experts is that this would be expected at this stage, and it really is too early to tell whether we have succeeded in flattening the curve or not. I think time will tell, but as I said at the beginning, the time to do what we need to do is now. We have some very restrictive measures in place, and I would do no more really than to echo the Premier and the Prime Minister. Go home and stay at home if at all possible.
I think what you're seeing with this is a situation where you look at a small province and you picture yourself in something what would be a very normal, and you do things with, for all the right reasons. You want to go and share and spend some time with the family at a funeral home. It's kind of a normal thing to do in normal circumstances within our province. But yet we see the impact of what used to be something that was quite normal in our lives, but yet now we see the profound impact that is having on our society in general, as just something as simple as visiting a funeral home to support a family in a time of need.
And if I could add, finding these cases is actually public health doing its job. This is what we want to do. We want to find as many cases as we can that are associated with any other cases, or associated with travel. So this is the public health system doing what it's supposed to do. It is not unexpected that we would find more cases related to previously diagnosed cases.
Right, and as a follow-up to that, I know that California announced earlier, I think last week, that they expect within 8 weeks to have over 50% of their population down with COVID-19. Do we have any kind of similar projection, or is it, as Mr. Hagee mentioned, just kind of too early to tell?
The discussion at the national level was around data collection. The Public Health Agency of Canada has offered us that kind of mathematical modelling. They did also point out, though, that they needed data, and it would take a little bit of time to come up with a low, medium, and high-risk scenario setup. And we are a little bit behind in some ways with reference to the other jurisdictions. We lag anywhere from 5 to 9 days behind in the evolution of this disease. That's good. So those predictions, I'm sure, will come, and I'm sure that the experts who last week were predicting what oil would do and what the economy would do are now furiously drawing graphs and becoming amateur epidemiologists as well.
Thank you.
Thank you. The next question is from Drew Brown with The Independent. Please go ahead.
Hey, so we're about a week away from rent coming due on the 1st of April. I know that there's some deferral relief for mortgages at the federal level, but does the province have any plans to defer or cancel rent payments while all the disruption is ongoing?
Yeah, so right now the programs that we have in place, with contracts, we'll continue to, pay those contracts as if we were using those. For when we work with Newfoundland and Labrador Housing, I know they're working with your clients as well. And we will continue to work with, people within the community that experience hardships through the various programs that we have, within our province. So yes, we have programs that will be in place, and this was a topic of discussion on our call last night. The federal government will be there to add support as well, and they're working on the measures to be able to put in place. We understand that the application process still could be just a few days away yet. But they're responding, as you would, I guess is quite understandable, even within the public sector and with the workers that we have, on hand right now. Many of them are working from home, so it's a little, it's not business as usual, even within government. But yes, to answer your question, we do have programs for the provincial government, but also anticipating more federal support as well.
Perfect, thank you. And just as a quick follow-up, I guess to sort of approach the same question from the opposite direction, does the province have any plans to consider maybe a moratorium on eviction for the duration of this?
Yes, we do, and I think later this week we'll be introducing some legislation, not stealing the thunder of our House Leader, but we'll be making some changes hopefully this week within the House of Assembly with the support of the opposition parties to actually put in place mechanisms during this time of hardship, not only to address areas like this, but other areas as well.
Perfect. Thank you.
Thank you. The next question is from Peter Cowan with CBC. Please go ahead.
Home care workers are often an important part of the healthcare system, but they are privately employed, privately run. We've seen concerns from workers who have no personal protective equipment. Many of them are calling in sick either because they don't feel safe or because there has been travel. What's being done to support those workers and make sure that there are enough workers for vulnerable people who rely on those sorts of services?
You raise an excellent point there, Peter. We've been in contact with the agency associations to see what their needs would be. A significant proportion of home care is provided through agency-provided staff. It's a little more of a challenge with self-managed care, and we have gone through the regional health authorities to ask them to identify those clients that they may have who have challenges in this regard. One of the big pieces around home care at the moment is in actual fact childcare provision for parenting. and we are working with Minister War and the Department of Education, and I understand there could be developments on that front as soon as this afternoon. So again, if there are any particular individuals who don't have an agency they can go to, their point of contact should be their usual point of contact through the Regional Health Authority, and we'll continue to work with the home care agencies collectively to see what their needs are.
And to follow up to Dr. Fitzgerald, now that we've had a worker with Canada Post who has tested positive for COVID-19, a lot of people are worried. Is there a risk that the mail I receive may be infected? Is there anything I need to do? What's your advice to people for when they go and check their mailbox?
So my advice is, as always, with anything, if you're out in public, you need to wash your hands frequently. What we know about this virus is that it tends not to survive in the cold. It tends not to survive on porous surfaces. So the risk is quite low with regard to transmission through the mail, if negligible.
Thank you. The next question is from Peter Jackson with the Telegram. Please go ahead.
Hi. I understand that paramedics, for the most part, their mandate is to take anyone into the hospital. They don't make the judgment. They take people in the hospital. And I understand now that they are being instructed in the case where they don't want COVID patients, they're being instructed to actually tell patients that they're not sick enough to go to hospital. This seems to be a very significant change in their mandate. And have they been given any training on how to handle that situation? How does that work?
That's a very disturbing comment, and certainly not one I've heard before, Peter. Thank you for bringing it up. We, through the RHAs, supply protective equipment to our Regional Health Authority employed paramedics, and my staff advised me as recently as yesterday that protective equipment was supplied in bulk or sent out in bulk from the department stores to the private operators. My expectation is that when a 911 call is placed and paramedics attend, they need to be made aware of the risk of COVID-19 if there's been travel or exposure. They do have the personal protective equipment, and they are expected to treat those patients according to the established algorithms by the provincial medical oversight. There are some paramedics whose training allows them to assess patients and to effectively discharge them at home. But by and large, the bulk of paramedics, particularly at the moment outside of the metro area, are expected through their own clinical guidelines to take patients to the nearest emergency department capable of dealing with their issues.
Thank you. My follow-up question is regards to a ferry, the Kamutik W, that is apparently stuck in ice at the moment. Passengers on board are obviously very concerned. There's a couple on that ferry apparently returned from travel. We're driving from St. John's, and they're all now stuck together. Is there any word that you have on this, and what sort of advice would you give passengers in that situation?
Yeah, so we're aware of that situation, Peter. And so what's happening now with on that voyage as it left Corner Brook, I understand. And so what we have are a couple of passengers that are returning. These are asymptomatic, I understand. And so they were on board that vessel on their way back to Labrador without getting into too many specifics. But what we understand is that they are isolated and that they are practicing proper social distancing, physical distancing, proper hygiene, and so on. So right now, it's we believe that there's no reason to be concerned, in this particular situation, and that they are kept in isolation and away from the other passengers.
Thank you.
Thank you. The next question is from Ben Murphy with VOCM News. Please go ahead.
We've seen, like you mentioned earlier, about public health officials stationed at the airport all day yesterday and today. they're handing out forms. Do you think that we need to be implementing more strict measures for screening at places like airports and ferry terminals?
Currently, and Dr. Fitzgerald can speak to the science behind it, currently we feel that we are doing what the public health advice is. We have knowledge of flights that come in from outside the province, and each of the regional health authorities has by and large got folk there who will provide that service. They also have a small supply of equipment should they identify anybody who could be a COVID patient. So they have some masks and PPE there as well. In regards to our other point of entry, the ferry from North Sydney, we have had a very collaborative arrangement from a very cooperative Marine Atlantic, and as of the outgoing crossing this morning, their staff have been distributing the leaflets, documentation and forms, collecting it at the end of the journey and then passing that on to public health officials in Western Health. Our manoeuvres, our activities in this regard are guided very much on the expertise of public health, and should their advice change, we'll obviously reconsider and reevaluate what we're doing at points of entry for people coming from outside the province.
And Ben, keep in mind is we were the first province to place restrictions on those visiting from another province for 14-day self-isolation. Other provinces now are doing something very similar. So in addition to self-isolation, we now have the information that we're gathering at the point of entry in our province as well. So it's important, not to forget. It's just not about passing out the information. Is the mandatory, absolute mandatory for 14-day self-isolation.
And further, we've heard concerns of ships coming into the Come-By-Chance refinery from all over the world with crew from all over the world. Now, those crew aren't getting off, but resident citizens of Newfoundland and Labrador are getting aboard to inspect these ships and interacting with those crew. What is government doing to control this point of entry?
Well, the same thing is there's measures around workplace health and safety, and so social distancing, proper hygiene, hand washing, and so on. So if these crew members were, coming to Newfoundland and Labrador, there would be obviously a need and requirement for 14 days of self-isolation. But, as I understand, as you just mentioned, they are not coming off. They're not disembarking the vessel at this point in time. But we must make sure that we maintain the proper practices, and we have health and safety inspectors that are available and visiting many sites as well to make sure that the regulations are followed. Of course, they cannot be to every single site, but we have the reporting mechanism in place, as Dr. Hagee has mentioned already as well.
Thank you.
Thank you. The next question is from Kellyanne Roberts with NTV News. Please go ahead.
Dr. Fitzgerald, have we had any of the cases in the province hospitalized yet?
No, I'm not aware of any hospitalizations at this time.
Okay. And Premier, I know I'd asked this question yesterday on a particular company out of Alberta that was telling its employees it didn't have to self-isolate upon return. I know we're saying that everyone must, as soon as they enter the province, to self-quarantine, but in looking at the exemptions online, and maybe I'm just misinterpreting, but I'm sure if I am, others are as well. The first point when it comes to the exemptions is that if you are returning from work, that you don't have to self-isolate. I'm wondering if there's going to be an honest exemption order or just going to add the plain print.
Yeah, so I guess Sue and Dr. Fitzgerald can speak to this as well, but it's very clear that if you're returning from Alberta, Saskatchewan, BC, or anywhere, any other province within this country right now, you have to self-isolate for 14 days. And so in some cases we know, and I've talked to many even constituents, that their turnaround period might only be 12 days as an example. So right now I know they are working with companies to actually do the extension around their working schedules, realizing that 14 days of self-isolation within Newfoundland and Labrador can be very difficult for some of them. But the message is clear. It's if you're returning from another province, it's 14 days of self-isolation.
Thank you.
Thank you. The next question is from Holly Mackenzie-Suter with the Canadian Press. Please go ahead.
Hi, I'm wondering about the forms that people are filling out when they come in at points of entry. I guess, can you explain where those actually go, what they're used for, and how long they're going to be kept on file?
We have those forms currently collated through public health in each of the regional health authorities where there is a port of entry. Their use is for public health to have access to them should an individual in the future either have a question about their own health or prove to be COVID positive on subsequent testing for some reason as part of a public health contact tracing system. On the advice of the Privacy Commissioner, our understanding is once the need to have access to such information is over, that we would be expected to destroy or dispose of that data in an appropriate way. So it's essentially healthcare information, healthcare data, and it's kept by public health officials.
Okay, I guess can two-part follow-up about that. To me, that sounds like once the need to have it would kind of expire after 14 days based on the advice that we have. But I'm also wondering if that information could be potentially used in any possible enforcement or investigation into these complaints through the reporting system related to the public health emergency order.
My intention and our intention when this form was put out there was to use this to secure the health and well-being of Newfoundlanders and Labradorians in general, as well as the individual who might be filling the form in. Should we end up walking down a road where we end up with some differences of interpretation about what someone should be doing at a particular time, our first approach is always around education. We have stressed over and over again at these meetings that this is about people accepting their responsibility, doing what needs to be done, and staying home unless there is some pressing reason for them to go out, provided they don't require self-isolation. And these people who are filling these forms in at the moment, as the Premier has said, they are mandated for 14 days of self-isolation if they have returned from outside the province or outside the country or have come into contact with someone who is COVID-19 positive.
Thank you. The next question is from Peter Cowan with CBC. Please go ahead.
One of the issues that you talked about there was $120 million to help support community organizations. Can you give me an idea of what specific things are you asking them to do, and how does that $120 million compare to the normal annual funding that you'd be giving these groups?
This is the normal annual funding, Peter, that we've put in place, and this is to continue to support the community-based organizations that have been doing so. If you remember, there's some 16,000 people that are attached to this, and they continue to work with communities and organizations around our province, providing, benefits. But we wanted to just issue some reassurance today that we do not have a budget yet. But we've been doing this in the past of announcing this, making sure that some of those people have employees that are under contract, and those contracts could potentially expire before the end of this month. So this is really about confirming that we're going to be there to support those community-based organizations and the thousands of volunteers that are attached to these organizations, providing many valuable hours of service. Keep in mind in this situation where Newfoundlanders and Labradorians, continue to support each other. We do so, and many do so, on a volunteer basis. But as these organizations, those umbrella organizations that actually provide the administrative support to manage those volunteers in some very difficult times.
And Premier, I want to go back to an earlier comment you made. I believe you said that if your business is not essential, it should be shut down. So far, the measures have focused on retail businesses. Does this mean that all businesses that aren't meeting that essential group need to shut down, not just the retail side of things?
What I'm saying is that there's a way to work in some difficult circumstances. So if you do so by practicing social distancing, making sure you can turn a waiting area, and we've had this discussion that if you have a waiting area and you do so, then you bring people in by appointments, have left chairs around. So this is really about making sure that if people can actually go to work in a safe manner without being, part of the spread of COVID-19, this is what we will continue to do. It's important that for many people, as you know, that if they can continue to work safely and not add to the spread of COVID-19, that is actually good for their health and well-being as well. So this is, keeping people safe, and for those that, can find a way that we can work in this environment without spreading COVID-19, well, some ways we want to respect that as well. But realizing that essential workers, we must be able to support them as well by putting in best practices.
Thank you. The next question is from Ben Murphy with VOCM News. Please go ahead.
We've seen Sobeys come forward in Atlantic Canada with hero pay for those workers. Will frontline nursing staff be getting hazard pay due to the medical state of emergency?
We, under the collective bargaining arrangements that we have with the unions, are bound with those terms and conditions. I would have to check whether or not hazard pay is something that is included in there. I suspect it isn't, but it's certainly something I can check on for you.
And just back to ambulance operators, is the responsibility to provide the personal protective equipment with the private ambulance operators themselves or with the regional health authorities?
We contract a service from the Department of Health from the private ambulance operators, and it is our expectation and I think our mutual understanding that they provide the equipment necessary to do the job and the personnel trained to do it. We will happily assist them under these circumstances where we can, given the nature of the pandemic, and this is part of our crisis planning and has been for years.
Thanks.
Thank you. The next question is from Kellyanne Roberts with NTV News. Please go ahead.
Dr. Fitzgerald, is there any information or do we know the recovery time or how long the virus can stay in your system?
So some people who have mild symptoms recover fairly quickly, 7-10 days, they're feeling better. And then other people maybe upwards of 3 to 4 weeks before they start to feel better. And certainly the most severe cases obviously can take much longer than that, depending on the extent of the severity of the disease.
And we talk about seniors and our vulnerable population being at high risk. How high risk are smokers and vapors?
So anytime you are inhaling things into your lungs that it's other than the air in the atmosphere, you are putting your lungs at risk. So anyone who has damage to their lungs due to smoking or vaping would be at higher risk for lung disease and complications of lung disease.
Thank you.
Thank you. The next question is from Peter Jackson with The Telegram. Please go ahead.
Yes, I'd like to ask further to one of the previous questions. And what is the absolute minimum time that someone has to be able to go out in public once they've had symptoms for this disease?
So what the recommendations are at this point is if somebody is had mild disease, so they weren't in hospital, in all likelihood at 10 days post onset of their symptoms, their cough, they are likely no longer infectious. However, for people who have more severe disease, and of course for healthcare workers, we're a little more stringent on that, and we like to make sure that they have follow-up testing done to make sure they're clear.
Okay, and just one last question, and I don't want to alarm anyone, but is there a time in the foreseeable future, since it's not considered really a necessity, that the liquor stores might completely close?
That's an interesting question, and I think we have in common with Ontario, for example, taken a harm reduction view. One of the challenges we have, and it predates the delivery of our alcohol action plan through the Mental Health and Addictions Group, is we don't know with any great detail the true prevalence of alcohol habituation or use in the community on an individual basis. There is a feeling, given the fact that 3 times more people a year die from alcohol-related causes as from opioid deaths, that we have a significant challenge from numbers. And at the moment, given the discussions I've had with the minister responsible for NLC and the measures that are being put in place by the NLC around phone orders and email orders and pickup and similar mechanisms in Ontario, the harm reduction manoeuvre, the balance at the moment is in favour of keeping the liquor stores open rather than shutting them down completely.
Operator, do we have any further questions?
We have one last question from Holly Mackenzie-Suter with the Canadian Press. Please go ahead.
Hi, just wondering about the contact tracing investigations. I'm wondering if kind of once those are complete for some of these new cases, eventually will we get more information about kind of the times and locations specifically related to a cluster if it's considered relevant, once these investigations are done?
So as the public health team and the regional health authorities do their contact tracing, what they will do is actually notify the contacts that they are deemed to be at higher risk. They will notify them of that higher risk and ask them to self-isolate, check to see if they have symptoms and whether they need to be tested. So that is ongoing, and anybody who is deemed to be at high risk will be notified. If public health feels that there is a need based on that contact tracing to make a statement regarding location or place, then that will happen. But at the moment, the contact tracing appears to be doing what it needs to do and notifying those people that need to be notified.
Okay, thank you. So at this point, it's done privately, but not ruling out the possibility that we might get a public announcement like that at some point?
If it was deemed to be necessary in the interest of public safety and for notification, that is always an option that we have in public health. And you'll see notifications, for example, if there was a case of measles on a plane, for example, that's something that happens not regularly, but it has happened in the past. So those sorts of public notifications can happen. At the moment, that is not something that is felt to be needed. So, but if it was needed, it would happen.
The time for questions has ended. Thank you very much for attending.